I am taking you guys with me to go get some Botox. That's right. Botox. Hello and welcome to Skinvis Beauty. My name is Judy Irizarry, professional makeup artist, and in this channel, I will be talking about all things beauty, makeup tips, skincare, and so much more, targeting adult skin. So before we get started, I haven't had Botox in the past couple of years. Last time that I did it, I just didn't like it. I just want to soften up my lines a little bit. Let me tell you what my problem, or what I feel my problem area is. This right in here. You know, I'm constantly doing that. Why am I doing that? I don't know. I've done my research and I have found an expert in Miami. So if you're in Miami, you're in luck. Do your research and hopefully this video will answer a lot of your questions out there. I am not promoting Botox. I'm not suggesting that everybody out there go and get this procedure done. Absolutely not. This is a personal preference and I don't see anything wrong with it. I'm in the beauty industry, so it's very common and you know, it's no big deal. But, you know, I mean, I have been torn with the idea of wanting to age gracefully and also who cares if I have a little Botox and alter what the hell I look like. I just want to look like the best version of me. I am meeting Tanya Patron, who is amazing. This is what I look like now. This is before anything. I am going to show you the before and afters. So look at me well. Let's get going. I am here and I'm ready to get this Botox. This is before. And I'll show you what it looks like right after. Hi everybody. I am here to get some Botox. And I am with Tanya Patron.
Hi you guys.
The expert injector in Miami. I'm gonna tell her what my concerns are, which some of you guys already know because I've already mentioned this. I think this is called the 11s. Is that what that's called?
The 11s is a common name for it. In the medical field, we call it the glabella, which is a group of muscles between the eyes that actually squeeze very tightly, and that's what creates those little 11 lines that you're seeing right now.
I hate them.
I know, a lot of people hate them.
I hate them.
But we can fix them. We can help with that.
So what I want to do is just kind of like get rid of that. Okay. I don't know, you mentioned earlier to me that we might need fillers if the indentation doesn't go down because I haven't had Botox in about a few years, and
so tell me a little bit about that experience.
I did not like it, and I got scared, and I didn't do it again. I want to keep some expression to my face. My brow bone is very important to me, like just lifting it. I wasn't able to lift it as much, and I had to like literally go like this to put on my makeup, and I was like, oh my god,
fun. Well, the good thing about Botox is that it can be completely customized depending on the look that you're going for. So we had a very thorough, in-depth conversation, and we'll kind of touch on that a little bit, but basically what she explained to me is that she wants to be able to lift the brow, and as you guys can see, her forehead looks beautiful. So as an injector, this is not really an area that I'm looking just to treat with Botox for no reason. What I want to do is just simply treat this area with Botox and maybe just give a little bit of Botox here around the corner of the eye so that this eye is more open as well. So there's a few tricks that I'll do on her today so that she can get a more eye-opening look without taking away too much of her look. So I also mentioned to you about maybe wanting to do a little bit of filler in this area. If you run your finger across your forehead, do you feel that little groove, that indentation that's there?
Yes.
So sometimes when somebody comes to me, if it's past, you know, the point where Botox is not going to give you the full effect of what you're looking for, we will do a combination treatment of adding in just a little bit of hyaluronic acid, which is a filler, under that area to give some structural support and help lift it a little bit more. It's not going to make the area bumpy. It's actually going to feel completely smooth to the touch. But we'll start with the Botox, and then we will actually have you come back, and then we'll see how that looks, if you're happy with that or not. If we want to add a little bit more, then we'll do filler at that time.
Perfect. Yeah. I trust you. Yeah. Whatever you want to do.
The good thing about starting with a little bit of Botox is that you can always come back and we can add more. If it's too heavy or it feels like too much, which sounds like what happened to you in the past, then you're not going to be happy with it, and you do have to live with that for the next 3 to 4 months. There's no drug that I can inject to remove it. With fillers, we do have something called hyaluronidase where we can actually break down the filler if you happen to be unhappy with it. But with Botox, you're kind of stuck with it until the body breaks it down naturally.
Cool. And what about crow's feet?
Okay, crow's feet are another popular thing. I don't like my crow's feet, so anytime I do my own Botox, I like to dose it up pretty heavy in this area, but that'll just help to also open up the eye a little bit. And so I do a little trick where I put it in the tail of the brow in order to give a more eye-opening effect. This is the bottle for Botox. It's really important that you do see the bottles, especially for you who have never seen this product before. I wanted to show you exactly what it looks like. And these come from the company. The company is Allergan. They're the ones that make it. It's FDA approved. Okay, so you don't want to get any crazy outside Botox that you order online.
Do not be cheap with your Botox, ladies. Okay.
So it actually comes in this bottle. See how there's no liquid in there?
Yeah.
And if I turn it upside down, I don't know if you can see, there's this little film of white on the bottom.
Wow.
That's the neurotoxin.
Wow.
So I'm actually going to pop open the cap, and I'm going to mix it with normal saline, and that's how we actually put it into the body.
How cool.
Okay. Now, there's a lot of units in the Botox, meaning that we can treat multiple patients with one bottle. Wow. So you may not always see it being mixed in front of you, but I'm going to do that today just so you guys can see how this works. This is normal saline, and I'm going to actually draw this up into a big syringe. This is not what we're going to use on you. Okay, and I'm going to transfer that to the Botox. And you know it's a good bottle because there's a little vacuum seal. See how that just sort of draws it right in?
Oh, wow.
And now this is our Botox ready for injection.
Very cool.
Okay. I'm just
what
going
do I do?
Just relax.
That's
okay. So I'm going to draw up exactly what I need. I'm going to make sure that the syringe is without any air bubbles. Do you have any other questions before we get started? It's actually a lot easier.
I just thought of something.
Okay, great, good.
So let me look at you straight on so you can see.
Mm-hmm.
This brow sometimes seems to like
be a little bit higher.
Just a tiny bit.
Okay.
Does that make a difference?
Yes, we can actually balance the symmetry. My goal is to actually elevate this brow to match the brow that your left brow. Raise your brows up really high. So let's look at the camera there. So smile really, really big. See, when you smile really big, this eye stays a little more open. This one tends to get a little bit smaller. So that pulling and that asymmetry actually comes from your orbicularis muscle, which is right here around the eye. All right, so I'm just going to clean you up. We did take pictures, so you guys will be able to see the transformation. And like I said, we're going to start with the injections first, and we're going to see how much improvement we can get with that. If she's still pretty deep in this area, then we will come back and layer it with hyaluronic filler. Okay, go ahead and look towards me. And just to revisit, have you taken any medications before coming here today?
No.
Okay, so no blood thinners, no Motrin, Aleve, ibuprofen, aspirin, nothing like that. Okay, perfect. So go ahead and lay back and just turn towards me, just because I'm 5'2", so I can't. All right, go ahead and squeeze really, really strong. I'm just going to grab the ends of those muscles, and you can completely relax. Okay, now you're going to feel a tiny little pinch. It feels a little bit like an ant bite. 1, 2, 3. You okay?
Mm-hmm.
Good. So we're doing our first injection. Okay, how was that? Perfect, great. Okay, we're going to do one on each side. These are a little more tender. Kind of like when you get your brows waxed or tweezed. It's a little bit uncomfortable.
Yeah, I feel like, I feel the pinch, but it's not horrible.
Good. So we're completely done with Botox there. That was it.
That's it?
That's it.
Oh my God.
It's that easy. So you'll have these little tiny bumps here for about maybe 5 to 10 minutes. You're barely bleeding, so that's excellent. And those will go down. So by the time we're finished with everything, you really won't see those bumps anymore.
I have to tell you, you've got a great
Thank you.
Because
I'm very soft.
I was like, that's it?
I can't get all the credit. We use very tiny needles here in the practice. So.
Yeah, it's good.
So go ahead, relax back. We're just going to do a little bit around the eyes. I'm going to open this area up just so I can see any little veins. Another little pinch. Again, we're going to stretch out the skin. You're going to feel a tiny pinch. And then now what I need you to do is squeeze your eye shut very tight. Okay, you relax. You're all finished with your Botox. That was it.
That's it?
That's it.
Takes like 2 seconds.
I know. But the treatment itself is very, very quick, very easy.
Super fast.
Yeah. So the rules for today are you can apply makeup right now.
Okay.
And what I don't want you doing is going to the gym and doing any heavy exercise. Basically, I don't want you to sweat. If you sweat, you're going to push the product
no
out of the
steam
muscle.
rooms or anything like
no
that.
steam rooms. Don't even go lay out at the beach if you know you're going to perspire, because you're basically just pushing the Botox out of the muscle where we just place it, and it's not going to work as well.
Got it.
It does take time for the product to work. So some people it can take anywhere from 2 to 3 days. Some people it can take up to 2 weeks. So I'm not going to see you back for 2 weeks time.
Okay.
That's when we'll have you come back. If we need to do any touch-ups, we'll do touch-ups.
Perfect.
And if we want to add the filler, we'll add the filler in at that time as well.
I'm excited.
Okay, and that's it. You did really well.
Thank you so much for having me.
You're welcome. Thank you so much.
I'll show you guys the results.
See you guys in a couple weeks.
Thanks. Okay, there's probably like these little tiny, they look like tiny little welts, but it's not that bad. I've had this procedure done before and I feel the needles a lot more. I'll keep shooting or taking a few pictures of the process and show you what it looks like in the end. Hey guys, okay, so it has been a week. As you can see, I still have movement. I feel like myself. I can raise my eyebrows. This problem area for me, which is my concern, my major concern, if I try to squint or squeeze it as tight as possible, I can't as much anymore. Looks great. If I bring you up close, you can still see those little indentations there. I'm trying to like find the lighting where you can kind of see. I am going in on Monday for my follow-up appointment with her, and she is going to treat that area with a little bit of filler. So I'm going to show you guys. And then the last area here, if I squint, smile, it is completely gone, and I'm loving it. I'm loving it. I feel like myself, like I said. And so I'll take you guys with me on Monday to see, you know, the final results. Hi everybody, I am back with my follow-up appointment with Miami's expert injector, Tanya Patron.
Hi everybody.
Before we get started, let me tell all of you guys out there, I'm loving myself.
Oh, good. You look nice and bright, yes.
Yeah.
I always see patients back after 2 weeks for a quick follow-up just to see how everything is kicked in. But let me take a look at your expression. So squeeze really strong here. Okay, good. So you still have some nice natural movement, and then smile really, really big. That looks great.
You can squint and nothing.
I know, that looks awesome. And your eyes are nice and open. This
Love
is nice
it.
and lifted. Are you having fun with your makeup?
Oh my God.
Of course.
You don't even know.
A true
So
makeup artist. Okay, perfect. So what I was saying before earlier in the video is that when we do Botox, it's really working on one component of this particular area, which is keeping the muscles from being hyperactive. So once the Botox is kicked in, what we sometimes are left with is a little bit of a depression, and that's from a lack of volume in the skin. So today, since she is back for her follow-up, we're actually not going to add any more Botox. What I'm going to do to complement what we've already done is to just add a little bit of filler or a hyaluronic acid, and the product I think I'm going to use today on you is a Restylane. The fillers come pre-packaged from the different companies. This particular brand is made by Galderma, and you want to make sure that anytime you're having filler done that the box is being opened in front of you for the first time. That's really important, so you know that the product is fresh, that it wasn't used. And this is a syringe, so it's not a very big, amount of product. A lot of people get very nervous about fillers and think, oh my God, it's going to make my face look different or crazy or overfilled, and that's really not the case. You'd have to go through quite a few of these to really alter your appearance to where you don't look like yourself. So we're just going to use a very small amount. We're not going to use this whole syringe in this area for her. It's just going to be a little amount just to sort of pillow up that little depression that she has there so that we can complete our look. Okay?
Awesome.
All right, so we'll get started.
Thank you. Oh, well, I have a question for
Yes.
you. What is the difference between a couple different fillers? Because I hear there's Restylane, there's Juvederm.
Right.
Like, what are the differences?
So all of those fillers are in the hyaluronic acid family of products. Basically, that's an injectable gel. They're all clear. It really depends on what you're trying to fill. So different products, you're going to discuss it with whoever's injecting you, your provider, to make sure that they're using the right products in the right places. So some things can be used in the lips, some things can't. Some things can be used in the tear trough area and others can't. So we have a lot of choices, and it's really just about choosing the best product, kind of like makeup, choosing the correct foundation to fit your skin type.
That makes sense.
Okay, so you ready for the filler?
I'm ready. I'm excited.
Perfect. I'm just going to kind of play with the area here. So if you guys can see when I'm squeezing and bending the tissue myself without her actually using her muscles, you can see right where that little crease is there. That's that little depression that you see, that little shadow that's picking up from the light. And if I run my finger across there, I can almost feel a little bit of a divot, of a depression. So that's really where I'm going to lay my product. And what's really nice about this product in this area is that it stays very, very flat. I think a lot of people think about putting filler here. Is that going to make it look bubbly? It's really, really not. I'm just going to remove some makeup here. And we're going to start with a very small pinch. So I'm just going to squeeze you here. And I want you to let me know if anything is really uncomfortable. Here you're going to go. Big pinch. 1, 2, 3.
It's not bad.
Now you have to be very careful in this area. This is not an area where you want to go to someone who's not experienced. How was that?
I mean, this is perfect. I didn't even feel much of anything. Okay. I actually thought it was going to be a lot worse.
A lot worse? Yeah, it's a little easy area there, and I think we're actually good. I think that's all that we needed. It wasn't very much at all.
Oh my gosh, that's awesome.
So now that I can feel that we're completely finished, this area is completely smooth, and if I squeeze it, see how that little hole doesn't actually pop down anymore?
I'm excited.
So it's nice and perfectly smooth. Okay, so I'm just going to squeeze on this side. This side we're not going to do as much. It's just going to be another little pinch. Okay, 1, 2, 3. This will probably last you in this area probably a little over a year, I would say. It's not an area that breaks down very quickly.
Cool. She gave me this little ice pack to put on here, but I don't feel anything.
These products, they come with lidocaine, which is a numbing agent, so that you don't feel anything. You feel the initial needle stick, so sometimes there's a little bit of a pinch there, but once the lidocaine infuses, you're completely comfortable.
I don't feel anything.
Yeah. I know. Sorry, it's not as exciting as people think.
Super easy, guys. It took like 5 minutes.
So with one little stick, we kind of
corrected
the whole thing.
I love it. This is so great. Good.
Yay.
Oh my God, girl.
Oh, high five. Looks good.
All right. Thank you so much.
You're welcome.
All right, guys. Thank you so much for watching.
Bye-bye.
These are my final results. What do you guys think? I'm going to show you the before and after picture right now. Before Botox and after Botox and filler. You guys, this has been the best Botox experience I've ever had. I had no bruising. I noticed a difference on the 3rd day, and in about a week, the Botox had completely kicked in, and I love it. I think that Tanya did a really great job. I love the fact that we didn't treat the forehead completely. When I've had the forehead done, that's what really drooped my eyebrows, depending on how they've done it. So next time, I trust Tanya 100%, so I think I'll probably treat that area just a little bit, just to soften it up. Her little technique of doing the tail end or injecting the tail end of the brow was genius. In the past, I've had injections done down here, just, a little bit further down to treat this area. And of course, I would numb that area. And when I would smile, it just kind of created like this weird effect on my face. I mean, it wasn't totally 100% crazy noticeable, but I noticed it and I really didn't like it. And as for the filler, which I didn't know what to expect. I was a little nervous at first, to be honest with you. She did the right amount. It's not overdone. It feels great. It feels like nothing's in there, really. Now, the filler comes ready or prepackaged in a little tube with a needle. So, and it's a lot in there. So if there's certain areas that you might want to treat on your face, you can ask your practitioner if that type of filler is okay to treat other areas that you're concerned with, because if you're paying for that one little vial, you might as well get some good use out of it. So that's it, you guys. In the description box below, I am going to link Tanya Patron's information here in Miami. So if you're interested, you guys should go see her. Let her know that you saw this video. Thank you so much for watching. Subscribe to this channel and like this video if you found any information useful. Please leave your comments below, any of your experiences, any questions that you may have, or if you have any ideas of different topics that you would love to see on this channel, let me know. Thank you so much for watching. I can't talk. Stop biting me. Why are you biting me? Say hi to people. Hi, people. I love you. I love you.